Hello everyone and welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're talking about hyperosmolar hyperglycemic state, or HHS. And as usual, at the end of the video, we'll go through some questions to see how much you've retained. So stick around for that. So what exactly is HHS? HHS is a life-threatening complication of diabetes, particularly type 2. It occurs when blood sugar levels stay dangerously high for an extended period of time. We're talking a blood sugar of 33 millimole per liter or greater. And it doesn't just spike and come back down. It stays elevated continuously over time. Now, this triggers a whole cascade of events. The kidneys go into panic mode and start trying to excrete the excess glucose and to take a lot of water with it. This causes the body to lose fluid rapidly. And because there are still many other substances in the blood, it becomes more concentrated, leading to a high osmolality level. That severe dehydration combined with the persistently elevated blood sugar can also lead to serious mental changes. One key difference between HHS and diabetic ketoacidosis, or DKA, is ketone production. While both are life-threatening complications of diabetes, HHS typically does not produce ketones. That's because there is still enough insulin to prevent the breakdown of fat into ketones, so that whole ketone cascade is avoided. However, that insulin is not enough to keep blood sugar under control. Now, let's look at the signs and symptoms. Because of that prolonged high blood sugar and the kidneys working overtime to flush the excess glucose out, the body loses a significant amount of fluid. This shows up as like dry mouth, extreme thirst, and frequent urination. In severe cases, it can lead to confusion, hallucination, and even loss of consciousness. This is a medical emergency. Moving on. What are the possible causes and triggers for HHS? HHS typically develops from uncontrolled diabetes, but certain conditions can set it off, and this includes infections, stopping diabetic medications, and even some routine medications such as corticosteroids, diuretics, and the typical antipsychotics. Now, let's look at the diagnostic checklist. How do we know someone has HHS? First, blood glucose, greater than or equal to 33 millimole per liter. Second, ketones, little to none, which is one of the key differences between HHS and DKA. Third, plasma osmolality, which is usually greater than or equal to 320, reflecting just how concentrated the blood has become due to dehydration. And finally, blood pH, typically greater than or equal to 7.3. In DKA, remember, as it is less than 7.3, so be sure to check out that video if you haven't already. For treatment, the protocol is quite similar to DKA. It involves IV fluids to rehydrate the patient, electrolyte replacement, particularly potassium, which must be corrected before insulin is given, and insulin to bring the blood sugar under control. There is also caution around rapid insulin infusion as we want to avoid a sudden crash in blood glucose that can lead to fluid shifts in the brain and cause cerebral edema. Okay, that gets to the end of the main content. Let's get into the questions. First, why does a patient with HHS typically not produce ketones? The answer is because there is still enough insulin present to prevent the breakdown of fat into ketones. Second, what is the minimum blood glucose level required to meet the diagnostic criteria for HHS? We covered this in the video. If you said 33 millimole per liter, that's correct. And lastly, severe HHS can lead to which mental changes? The answer is loss of consciousness. That brings us to the end of the video. Let me know in the comments how many questions you got right. If you found this helpful, please like and subscribe, and I'll see you in the next one. Thank you.